all these symptoms within 2 to 4 weeks. You can have a fever, sore throat, which we call lethargy, and problems of not working. You may get tired easily, you may lose weight, you may have lumps in the neck or chest, which we call lymph nodes. When any of these problems occur, we call it acute HIV. Now, if we don't catch acute HIV in that stage, it turns into chronic HIV. Chronic HIV is when your acute symptoms are gone, but the virus is still there. If we treat at this level, we can avoid diseases like AIDS. Today, we will learn the difference between HIV and AIDS. HIV, that is human immunodeficiency virus, is a viral disease that can be transmitted through an infected needle or infected blood or through unprotected intercourse or any blood infection or from mother to child during delivery. And this infection does not mean AIDS. AIDS is a disease that can develop if the infection is not treated in time. If you are diagnosed with HIV, you have received an infected blood or an infected needle, or you know someone who is a drug addict, you should definitely get an HIV test. HIV testing can prevent HIV from turning into AIDS. AIDS is a disease. HIV is an infection. When you get AIDS, you get physically weak. You lose weight, you lose muscle mass, your body's ability to fight off foreign viruses and other bacteria decreases. You may get secondary infection. Many patients come to us with tuberculosis or what we call opportunistic fungal infection. What we call fungal infections such as aspergillosis or candida infections called oral thrush or urinary and latrine tract infections, these events are very disturbing. So we want to tell you that if you have any such infected needle or infected blood or unprotected sex, you should definitely get your HIV test done. HIV testing is very important nowadays and it is available everywhere. You can also go to any street or corner and get checked if you don't want to go to a hospital, or it is free in government hospitals and some centers. You can do a preliminary HIV test, which is then we confirm it with another test. When this is confirmed, most of the ART centers are what we now call antiretroviral therapy centers. This is a campaign by the government where you can get free treatment, and some private centers also offer the same treatment. There are some centers for this treatment, what we call ART center. It is a campaign by the government where free treatment is provided, and some private centers also provide the treatment.